Welcome back to Creative Brain Week, a day focused on attention. How does attention work? How does it change? What happens when it changes? And that's really where the afternoon, excuse me what I remember with my mic, is going. What happens when it changes? What happens when the environment of our attention changes? This is a session really, Creative Brain Week are delighted to be supported by Aquired Brain Injury Ireland who helped make this possible. In particular, my friend and colleague, Grainne McGettrick. Hello. So I have to read titles and they're in tiny print and my eyes are really not great. So your official title is Policy and Research Manager at Aquired Brain Injury Ireland, which is how we came to this session called I've Walked a Mile in Their Shoes. I'm going to hand over to you.
Thanks, Dominic. Thank you very much. And good afternoon and welcome to the session here on the theme of attention. And hello also to our online community. The session is a panel discussion on living with an acquired brain injury in Ireland. I've walked a mile in their shoes. A key question around this theme is what happens when attention changes. Our panel of clinicians will share their 360-degree experience of what happens when your attention is altered when a life-changing brain injury happens. I know we are in for a very special hour that will focus your attention in a unique and powerful way. So as I've already been introduced, I'm the Policy and Research Manager in Aquired Brain Injury Ireland. We provide services to people with the brain injury rehabilitation services in the community. I'm also a Global Atlantic Fellow for Equity in Brain Health, having had the privilege to complete the fellowship programme here in Trinity last year. Please note for this session, there is no flash photography allowed. A very, very warm welcome to our three panel members who've travelled from various parts of the country to be with us here today. Let me introduce you to them. So here we have Magella. Magella Cassidy is a senior occupational therapist working in the field of acquired brain injury and dementia. Her clinical work has been predominantly in the field of acute stroke, stroke rehabilitation, traumatic brain injury and neurological conditions. Currently, she's working in the Cottage Hospital in Drogheda as a senior occupational therapist in the care of the older person clinic. To my left is Dr. Niamh Lowe, and Niamh is a clinical psychologist and is a graduate from the clinical doctorate programme here in Trinity. Worked in child, adolescent and adult mental health services since graduating in 2018. Her next appointment is a senior psychologist post in the HSE Mental Health Services, where she returned just after her maternity leave in 2 weeks. Her experience of brain injury led Niamh to become interested in neuropsychology and brain injury, doing placements and research into it at both her master's and doctoral levels. I know that Niamh's doctoral research on the experience of loneliness and brain injury will be of interest to many of the members here in the audience, so hopefully we'll get a chance to talk about that when there's a lull.
Yeah.
And in the middle is Alison McCann, and Alison is a senior occupational therapist at the National Rehabilitation Hospital, where for 20 years she worked rehabilitating people with acquired brain injury. Her specialist interest is disorders of consciousness. She has engaged in research, authored several research articles and a book chapter, and presented her work at national and international fora. So in terms of the format here for this afternoon, for this hour, we will have a contribution from each member of the panel, and then we can open up the discussion to the audience in the room and online. So I'm going to start with you, Magella, if that's okay. Magella, you have a remarkable story to tell us. Can you bring us back to the day when you knew things weren't right and how that impacted you?
Yeah. Hi everyone. So it was back in September 2018, so just under 6 years ago now, and it was only about a week after my 36th birthday, and I was feeling unwell for maybe a few days before with a chest infection and a bad cough. And I was quite unwell that morning, and I was living at home with my parents at the time. I was actually buying a house, and I was up at 4 o'clock in the morning with a busting headache. And I went up to the kitchen. My mum was in the kitchen, and she said, "You look awful. Go back to bed." And I said, no, I couldn't, because there was no one to cover me in work, because the other girl that I shared the post with, she was on annual leave. So decided to go on ahead in the car into work. And so about halfway to work at this point, I felt like I was going to vomit. I felt very, very unwell, and I coughed really heavily. And because I felt like I was going to vomit, I pulled the car in at the side of the road. And that was when things started happening. So I must have said something out loud, which meant that my voice, my speech sounded very funny. And then I looked in the mirror in the car, and then I could see a facial droop. So I kind of had an idea maybe I was having a stroke at that point. But I was like, if I can just get myself to the hospital, I can see a doctor and they can sort me out there. So I went to put my left foot on the clutch, and the power it just wouldn't press down. So, and then at that point, I looked over and my hand was sitting on the gear stick. I had no feeling in it. I didn't even know it was there at that point. So I still was feeling sick. So I decided for some reason to get myself out of the car. And I don't know how I did it, but I got myself out of the car. But then I was on the ground, lying on the ground. And I realized at that point then, I was like, okay, actually, you do need help now. So, but my phone was in at the gear stick. So I tried to pull myself up with my right side, but it was impossible at that point. I had completely dense weakness on that left side. It was completely gone. So I remember just, I shouldn't be laughing at this, but I remember just lying back and just feeling this kind of overwhelming sense of calmness, actually, and kind of knowing, oh, well, it's not really I can do now. But thank God, two women drove by. They were actually in separate cars, and they stopped because I was actually at the side of the road, so you could see me. And they stopped, and they knew straight away that I was having a stroke. They had heard of the FAST campaign, so they knew I was FAST positive. And that I ticked all the signs and symptoms, basically, of having a stroke. And I definitely knew they knew as well, because at one point they called my mum on the phone, and they told my mum that we're calling the ambulance, we're bringing her to, I think she's had a stroke, you'll need to go to it. So they did call the ambulance. The ambulance person did get them to the FAST signs as well. And at that point, I remember... and I'm never one to be made a fuss of, so I don't like that. But I remember saying, I could hear the ambulance crew asking me, asking them, was I FAST positive? And I said to them to stop fussing, and I was doing it in my slurred speech as well. So I was obviously having a full stroke, but your brain is divided in two, literally. But one is kind of working, and I knew I was having a stroke. I work in stroke rehab, so I know all the signs and symptoms, but the other side is just not really with it, and I'm kind of thinking, I'll be fine, Anyway, they bring me straight away into Drogheda. Sorry, this was about 8:30 in the morning, by the way. I go straight into AD in Drogheda, and obviously that's where I'd be linked with a lot of the clinicians that work there. And I straight away came in the ambulance, and I had my green work trousers on for being an OT. And Fiona, the clinical nurse specialist, she met the ambulance at the door, and she seen the green trousers. She either thought it was an ambulance crew or an OT, and then she seen me, and she got quite a shock, actually. So it was all hands on deck then. And the consultant, who I still work with now, came down, and they brought me in. They did the whole bringing it down for CT to make sure that it's a clot and not a bleed, and then they were able to give me TPA, so the thrombolysis, so the clot busting drug. And they did that their record time, so it's called door to needle time. They kind of record how long it takes to do all the steps before they give the drug to you. And they broke their record with me, so it was 27 minutes, and it was 23 with me. But I think they've broken it since as well. So that is actually quite an impressive time as well, as far as I know. So, and because they gave me the drug anyway, but I was also then suitable for what's called a thrombectomy. So I went straight up to Beaumont for a thrombectomy. So that's a procedure where they kind of remove the clot from your brain. So mine was called a right MCA infarct, so a right middle cerebral artery, so the artery that feeds the blood to certain parts of your brain. And it was, I think what they said, was completely occluded, which I think means completely blocked off or almost. And so they give me what I think is called conscious sedation. So I'm kind of half awake, but I'm not fully. And they go through the artery in your groin all the way up into your brain, and then they retrieve the clot. And what's amazing about that is that it felt like straight away, but I think within a few minutes of that happening, they asked me to lift my left leg in the air, and I straight up into the air that I could do that. And then by the time I got back to Drogheda, because they repatriate you back to your own hospital, I had all movement back in my left side. And how I knew that, and it always makes me emotional, this one, was that the nurses in A&E and everyone that knew me said that they knew I was okay, because the first thing I did with them when I was on the trolley was I waved at them with my left hand. So that was quite nice. So yeah, I was 6 days in hospital after that. And the only reason I was in 6 days, I didn't really necessarily need to be, but they weren't sure as why I had my stroke. I didn't have any obvious risk factors that I knew of beforehand. Mine was from what's called a carotid dissection, so like kind of little tear in your carotid artery that feeds the blood into your brain. And they don't know how I got that. You can get that from trauma or various other ways, but they're not sure. But yeah, so that's. But I made a. As you can see, I made a full recovery. I think if I was walking down the street, you'd never know that I had such a massive event, really, or a stroke. Yeah, yeah.
Thanks, Magella. Thanks, Magella. We often hear about the stories when things go wrong, but
Yes,
yours is like textbook when things go right.
Yes, it literally did
Yeah,
go. Yeah,
that's fabulous.
I forgot to say I had my stroke at 8:20, 8:30 a.m. And I think I'm almost positive I was back to Drogheda at like lunchtime.
So that's your local hospital. So the whole
Literally
thing
the
was
whole
done.
thing
Yeah.
from when I started having it
The
to
thrombectomy, right?
yeah.
Fabulous. I know there's a million questions in my head,
Yeah,
but
that's
I'm
okay.
going to come back,
yeah.
Particularly with your clinician hat on again.
Yes.
Niamh, I'm going to move to you.
Yeah.
And Niamh, I know you equally had a fairly traumatic experience a couple of years ago.
Yeah.
So perhaps you might tell us a little bit about that story and how it impacted you.
Yeah, okay. So my accident was in 2010, so it's mad that it's so long ago now. And I feel like I've been beating the drum or talking about it a lot. And even when I was looking over kind of notes for this, preparing, I was like, God, it's, so much has happened in the interim. But anyway, so 2010, I was 21 and I had just finished college. I had done an undergrad in psychology. So I finished in the May, and then I think in the July, I had a road traffic accident and had a severe traumatic brain injury. So was in a coma for 10 days, and when I came around after that, though it was induced coma because my brain was swelling and they were trying to get that under control. So when I came around from that, I had quite significant impairments. So all in all, I think I was in hospital for 5 months between general hospitals and the rehabilitation hospital. So when I woke up or became conscious, I couldn't speak, I couldn't walk, couldn't eat, couldn't communicate, my memory, my attention were really, really shot, I suppose. And through my time in the various hospitals, I had access to like occupational therapy, physiotherapy, speech and language therapy, psychology, so the full remit of rehabilitation services. And I suppose it was a very difficult time, as I had kind of, graduated college and was all excited about, career progression and working in the field and doing a master's and traveling and all that. And I suppose I was completely like back to being a baby again, having to, get help with toileting and showering and learning to feed myself again. And then I made quite good progress in rehabilitation hospital, but then even coming home, there was, I was back living with my parents, I couldn't drive, still in the wheelchair and on the rollator, kind of doing physio quite a lot to try and get back some of my independence. And I'll speak about it a little bit more as we go on maybe, but I suppose, initial part after my accident, there was the really, observable, measurable kind of physical stuff, like, I couldn't walk, I couldn't talk. and then kind of, you could see my balance and my gait getting better as, as I was accessing physio and that, and as time was going on. But I suppose as my physical functioning was improving, at the same time my kind of emotional maybe state or regulation was disimproving. And yeah, and I'll speak more to that in a little while, but yeah, that was my journey. And as you were saying, Magella, I have made a very good recovery now, and it's I suppose it's kind of a positive story as well, in that I did have great access to services, and I've gone back and done my master's and my doctorate in clinical psychology since, and I've had a lovely baby, and yeah, so it's been a positive experience.
Yeah.
But yeah.
Okay, Niamh. Thank you, Niamh. That's wonderful.
Okay.
Thank you. Yes. Thanks, Niamh. At 21, that was something to be served up in your life.
Yeah.
For sure. And we'll come back to the rehab piece again, and that some of the tricky bits.
Yeah.
Okay. And Alison, over to you. Alison,
Thank you.
in terms of your life and what has happened to you, do you want to tell us a little bit about what happened and how that impacted you?
Sure. Thank you, Grainne. And just what has struck me is it's always amazing to hear how some of the folk who come through the National Rehabilitation Hospital have said to me and said to my colleagues how positive an experience such a traumatic event was, right? And you've heard that as well in your work. So, okay, it gives me hope as well.
Yes.
So my experience is quite different. We've all had very different experiences. I have a neuroinflammatory condition that is with me and will be with me for the rest of my life. I have autoimmune encephalitis, and autoimmune encephalitis is a very rare condition. About 40 people per year are diagnosed with autoimmune encephalitis in Ireland. And in the UK, I think 0.8 per 100,000 have the diagnosis per year, so extraordinarily rare condition. And just a quote from a very eminent consultant neurologist in Oxford, he described me as a case with, in inverted commas, considerable diagnostic complexity. Not exactly now what you want to be reading about yourself, but anyway, that's what he said. And I think my team in Beaumont Hospital would fully agree with that gentleman. It has taken, or it did take, well over a year for the team in Beaumont to really nail down what was happening with me and what was going on. So I suppose just to go back to 2019 and early 2020 when I started to feel unwell, I had a really nasty cold or flu-like symptoms that Christmas. And this is a little bit in the backdrop of COVID, when we hadn't really heard of COVID, but it was lingering in the ether somewhere. It was really March, I think, of 2020 when we heard about COVID, but I certainly had a really bad flu, and it was hard to shift it. After the flu, I just was very run down. I had what felt like sinus infection that was really difficult to shift. I then developed shingles along my trigeminal nerve. So the trigeminal nerve innervates the muscles here just above your forehead, along by your temple, down into your hard palate, and then further down along your jawline here, past your ear. So I had the shingles along the second branch of the trigeminal nerve, and I actually believe they probably infected the glossopharyngeal nerve as well, so another cranial nerve that controls the movement and activity sensation of our tongue. Because I started to have this really awful burning feeling on my tongue, and I developed dystonic tongue movements. And all of this emerged in June of 2020. And I remember asking a speech and language therapist on the day that I got sick to look into my mouth. No better person than a speech and language therapist to look into your mouth and have a look at my tongue. And she said, Ali, there's something really wrong with you and with your mouth, with your tongue. And she said, you look awful. It was a great compliment as well. I know you got similar. You look awful, and I think you really need to go home and see your doctor. So I packed up, spoke to my manager, and the shingles actually had been treated 2 months earlier. Using the usual correct protocol, acyclovir for 1 week and 2 weeks rest. I needed an extra week's rest because I still wasn't feeling 100%. But anyway, June, off I went home from work. I drove 110 kilometres home. I sat on my sofa with my notebook. I bring a notebook everywhere, always one for lists. So notebook and pen, and I was writing down a list of symptoms, very strange symptoms that I was having: headaches, this kind of pressure in my head, this funny sensation down my face, this dystonic tongue movement, uncontrollable tongue movement. That's what the word dystonia means, uncontrollable. And all of a sudden, the pen dropped out of my hand, my arm flexed up, my head jerked to the right. I called out. I couldn't hear my voice, but I was calling and calling. I couldn't hear my voice. My eyes were jerking to the right. I said a prayer in my head because I knew I was having a seizure. I knew that that's what it was. I'd seen so many of them in my work. And I didn't lose consciousness during the seizure, but afterwards I felt very sleepy and I went to sleep. And then once I woke up, my sister who lives next door, I gave her a call. I said, Maria, you've got to come help. I've had a seizure. I need to get to hospital. And off I went to the local hospital where I remained for 6 days before moving to the neuro specialist hospital in Ireland, which is Beaumont Hospital. So those 6 days in my local county hospital were really, from what I recall, they were grueling. The only good part was the food. Isn't that remarkable? What a surprise, isn't it? So the only good part actually was the food. I do remember some good food and some very good nursing. And I remember the faces of the older ladies. We were in the height of COVID now. It was June 2020. And I was in what should have been a 6-bedded unit, but was now an 8-bedded unit. And there were 4 ladies opposite me. And one in particular was so petrified when she saw me having seizures. And I know I had 2 tonic-clonic seizures during my time there. And I just seemed to be in and out of consciousness all of the time. However, I was discharged from my county hospital to Beaumont Hospital with the diagnosis of pseudo-seizure activity. Query, functional neurological disorder. So pseudo-seizures, were they real or were they not real? Okay, and I guess the reason for that diagnosis was the MRI scan in the county hospital was normal. The lumbar punctures were normal, as analysed in the local a laboratory, and the CT scan was normal. And I think I prefaced by saying that it took well over a year for the specialist team in Beaumont Hospital to really identify the cause. So autoimmune encephalitis caused by zoster virus, so shingles. Shingles was the cause.
Alison, would you mind using that?
Yes, of
Yeah,
course.
I
Yeah,
want you to use
is
it. Yeah.
that better?
Yeah.
Yeah,
Is that
better
okay?
sound.
Yeah.
Yeah.
Okay.
Okay.
Okay, Alison.
Yeah.
Thank you for
Yeah,
that,
no
Alison.
problem.
Yeah. Michael. And I'll come back to you because I know you have a lot more to say in terms of the support you got and all the challenges that you faced in your life. So is that okay? We'll come back. Yeah. Are you okay with the microphone?
Yes,
or do you want-
yes,
yeah,
that's
okay.
fine. Yeah.
Okay. So what strikes me is the challenge of getting the diagnosis. So having something so rare is so challenging
Yes,
to really kind of get to the bottom of it.
that's right.
And I know it was Rare Diseases, Rare Disease Day on the 29th. So it's
right.
quite
1 in
timely.
17.
One in 7. That's phenomenal, Alison. Yeah, phenomenal. So I'm going to come back to you, Alison, in a few minutes. I'm just going to jump back to Magella in terms of the trajectories are so different.
Yeah.
So within 5 days you were discharged. Tell us a little bit what life was like after that, and what maybe what
in the hospital then,
after you were discharged, and some of the challenges that you faced
yeah.
in your day-to-day life.
Yeah, so I was off. I took about 6 months off work, and that was really mainly to do with what we call post-stroke fatigue, which I do still have at the minute, but I'm like 100 times better. And that was like quite extreme on the initial stages of like post the stroke. So I remember like sleeping, like I wouldn't be great at sleeping at night anyway, but I was sleeping 10, 12 hours, and then I'd get up and I'd be awake for a couple of hours, and then I'd sleep for another hour, you know, which was not obviously not usual for me.
Yeah.
So there was the fatigue. There was a lot of I think I kind of developed maybe a little bit of anxiety as well. I felt that. Now I didn't feel that initially, even in the first 6 weeks, should I say. I felt kind of elated maybe because, oh look, I had a stroke, and I came through that, and I'm fine. But then I went back for, I think it was 6 weeks post the stroke, and I went back for an appointment with the consultant. And I asked him to see, could I see my brain scan? Which he said, "Now, you sure you want to see it, because it can raise kind of emotions and that." And I was like, yeah, I've seen loads of scans before, it'll be fine. And then the minute he showed it to me, I could see the mark of where I had the stroke, and you could see how big it was. That kind of really hit home from there, that I actually did have a stroke. Like, I don't think I was in denial that I had one, but I don't think the enormity of it really hit home, because I think because I was so fine so quickly, it kind of just went through the motions. So I think from that I maybe developed like a little bit of anxiety around, just worrying that could I have another one. And actually at one point, a few weeks later, I was just sitting in the sitting room, but I had been leaning on my left arm quite heavily, like just watching TV with my mum and dad in the room. And I remember feeling the numbness in my arm, which was just because I was leaning. But I went up to the room and it didn't kind of resolve. And I was like, oh, I don't know about this. And so I just actually went back up to my mum and dad and I said, can you just bring me back into A&E? And the consultant said that wasn't unusual, that a lot of people can go back in with things like that when they think they're having another one. So the signs, because as well but anyway, sorry. So that was the anxiety. But then I was able to get some counselling from the Irish Heart Foundation, which I think it was about 6 sessions that I got, but then I continued on for a while after that, and that was really, really good. I'd recommend it to anyone, even if you haven't had a stroke. Yeah, that was really good to have. I was able to access that service, and I also about returning to work, because I think I lost all my confidence really from professional point of view, because is this person who now is known to have had a stroke, who's had an injury to their brain, who works with people, who rehabilitates people with stroke and brain injury, and can she now actually do her job? Because as well, you're as an OT, you're very aware of the difficulties that people can have post the stroke, all the cognitive difficulties, and as I said, the fatigue would have affected like my concentration levels, and and that in itself. Then we talk about attention, being able to concentrate on things, taking that information in, and then storing it in our memory, and then being forgetful. And like, I was working on the stroke rehab unit, and that kind of entails knowing the ins and outs of a lot of the patients and their information. So I kind of lost that confidence. So the counselling was helpful about returning to work, but also I was able to access the vocational assessment in the NRH as well, which did up a big report, and it did like a whole assessment on my cognition, and it kind of proved actually, I'm actually okay. Yeah, I'm not. Yeah. Not too bad.
So interesting. You're talking about the imposter syndrome almost.
Yeah, that's it.
And
Exactly.
the confidence that challenges that brought.
Yeah.
But back to the stroke unit you went.
Yes, I did. Yes. And actually, the struggle with going back to the stroke unit, I didn't mention it in the initial story, was that when I was admitted into A&E, I think I said this to you before, that I was lying down, and they're obviously removing your clothes and removing everything, and I just remember thinking, oh my God, did I shave my legs? and what underwear am I wearing? Because literally everyone around me was people I knew. And so then when I went back to work, I'm like, oh my God, they all know what I was wearing that day. So it was like, yeah.
And I must say, even finding that humour, it's so black, but it is, finding humour in those very adverse situations is wonderful. Thank you, Michela. Niamh, I'm going to come back to you for if you want to round off your story a little bit in terms of your experience of accessing rehabilitation and some of the challenges that you faced, even though you were physically doing quite well and all of that.
Yeah.
So do you want to talk to us a little bit about that?
Yeah. So I suppose, from being in hospital and accessing an OT and physio, and I suppose as well as the kind of visible stuff, there was like neurologically, I suppose my access to psychology was around neuropsychological assessment. So they did a full battery of tests with me when I was in hospital, so looking at attention, executive functioning, and a higher order processing. And that, I suppose it was assessment, and it came back with a report and some recommendations. And so I suppose when I went home then, my access to rehabilitation services was kind of in the form of a rehabilitation assistant, and it so happened that the rehabilitation assistant was actually a physio. So continuing to kind of work on my walking and balance and that, and that was really helpful, and it was really helpful to have access to those services. But I suppose, as I kind of mentioned previously, as my physical functioning was kind of improving, my emotional state was disimproving, and I suppose my emotional regulation, and that may have been to do with the brain injury itself, but also the kind of trauma I'd been through and adjusting to all of life, I suppose, after the accident. I was kind of having quite extreme mood swings, and I was going through periods of very low mood, and my parents were getting quite worried, and I suppose I was worried myself because I hadn't been someone who'd suffered or experienced intense kind of emotional distress before, and so mom and dad did reach out to community services, brain injury community services, and said Niamh's mental health is really deteriorating. And I was speaking about suicide as well, and so I had gotten very low. And I guess it was kind of, and like after a brain injury, often the physical progress is very rapid at the beginning. So I was, week on week, seeing improvements. And I guess as time goes on, that kind of plateaus a little bit. And so I was kind of saying, okay, I'm left, and my friends have all moved on. I haven't. So mom and dad reached out, and psychology, I suppose psychological help at that time came in the form, again, of a battery of neuropsychological assessment tools. So again, looking at attention and executive functioning and I suppose, memory and sequencing and planning. And again, which I suppose assessments are designed to do, it was kind of telling me all my deficits, or that's how I saw it at the time, and that may have been to do with the frame of mind I was in, but all the things that are wrong with you. And here's how you can, manage the situation with all of the deficits you now have. So that really didn't address any of the emotional issues. And I suppose after that, my mental health continued to deteriorate, and I ended up being admitted to a psychiatric inpatient unit. And it was at that stage, so that was 3 years after the accident, it was at that stage that I met a psychologist that I sat down opposite, and she said, "Oh my God, you've been through a horrible experience. How are you?" When I started speaking about the emotional impact and, the adjustment and what had happened. And I suppose it was at that stage that I, actually began to properly address some of the underlying kind of emotional impact. And doing that, I suppose, going to that place and having someone kind of go through it with me and having that therapeutic relationship allowed me to, I suppose, begin to heal from that. And it was after that I was in psychiatric hospital, I think, for 3 months. And it was after that I did the master's, and so did the master's, and was working in Headway, a brain injury organisation, for a while. And then I did the clinical psychology doctorate and did my thesis on brain injury research. And so I guess I've been kind of drawn to brain injury and researching and working in the area. I know at the moment I'm not working in it, but it's something I'll always be, I think, drawn to work in or have some connection with. And is there anything else I wanted to say on that? No, maybe I will in the future.
So what I hear you saying, Niamh, is somebody that was sitting opposite you, just the humanity of it allowed you to open up and begin to heal. And begin to grow and come back to yourself again. Yeah. Thanks, Niamh. Thanks very much. I'm going to come back to you, Alison. You're not off the spotlight yet. Alison, will you tell us a little bit about how your brain injury is impacting you as we speak? And if you wanted to say something specifically around your role as an OT and how that impacts how you view the world.
Yes, my life, I suppose, has been turned upside down. There's absolutely no doubt about that. I am not working at the moment. I am not driving at the moment. I have refractory epilepsy, so that means that my epilepsy isn't controlled. I still have seizures. The longest period of time that I've been seizure-free has been 7.5 weeks, which is a very short period of time, unfortunately. I take 147 prescribed tablets a week for epilepsy and steroid-induced type 2 diabetes, so high doses of steroids in the acute phase of my treatment. I attend Beaumont every 3 months for IVIG, 5 days of IVIG. So IVIG is immunoglobulin replacement therapy, which I am responding very well to. It is helping to suppress and keep the level of infection in the brain under control, to try and keep those keep the healthy brain tissue stop it from attacking itself. So that is what the encephalitis is, isn't it? Yeah, life is upside down. I can't be on my own at night, particularly, because that's when I'm most susceptible to having a seizure. I have the chronic fatigue that Magella spoke about. Every afternoon I need to rest. That usually involves sleep for me, but also I do try to meditate if I can. Which I find as effective as sleep. And I know that there's growing depth of research on the effectiveness of meditation on neuroplasticity, which is really promising. What else goes on in my life? Oh, yes. So things like I have trigeminal nerve. What's the word? Please help me. Palsy. Not palsy, but hypersensitivity. Let me see, what's the word? Neuropathy. So I have neuropathy down the right side of my face. So I don't wear makeup anymore. Sometimes I need to be supervised if I'm brushing my teeth or washing my face, because that can trigger a seizure if my nerves are feeling particularly sensitive. And if that's the case too, I need to take extra medication, some anti-inflammatories to knock that out. So yeah, look, I keep the pharmacist extremely busy, for sure. What else happens?
One of the things you were saying, Alison, that you were trying to do in terms of your brain health was to get out in nature.
Oh, for sure.
And enjoy.
Oh, absolutely.
Yeah.
Absolutely. And I just also want to just come back. I will come back to that too, but I really want to emphasize, as an occupational therapist, and I hope perhaps, I think Professor Robertson will agree, and Magella, that sleep needs to be really valued as an occupation within itself. As occupational therapists, we view every activity as an occupation, as something to be valued, doing, being, becoming, and sleep is a very, very integral part of brain recovery, and it needs to be prioritized up there with physiotherapy and with some of the core therapies, psychology, and your speech and language therapy, and so on. So, and sometimes I know in rehabilitation, for sure, we disregard it as being important, but it is so essential to brain recovery and brain health. And there are also supplements that I would take to enhance sleep, so, and actually recommended by Beaumont pharmacy department, so things like selenium, magnesium, and so on, to support that. But yes, getting out in nature, really important part of my recovery. And I'm so lucky to live in a green field area down a quiet country road. I also live close to the sea, and my professor now in Beaumont Hospital, he rolled his eyes when he asked me what were my rehab goals when I was being discharged. He said, what do you want to work on now when you go to rehabilitation at the NRH, and what do you want to achieve? And I said, I want to be able to stand on one leg and be able to sea swim. And he just rolled his eyes. He said, he just told me I wasn't to take a bath. I was never again to get into the bath due to the risk of having seizures. So here I was talking about cold water immersion. But I remember one of the first things I asked my dad to do was to take me to the river, the local river, so that I could put my feet, just my feet even, into the cold water. I craved it. I craved the cold water. Perhaps something to do with inflammation. I have no idea. I just wanted the cold water. So my sister over there takes me with my toe float and sorry now, Prof. Delanty, I hope you're not listening. But Ash knows all about my seizure first aid, and we do sometimes have a little paddle in the sea. Yes. So those kinds of things are really, I value them. Yoga, I was in Beaumont Hospital in the height of COVID, and it was one of the first things I asked for. I said, please, can I bring in my yoga mat? Yeah. So my aunt brought in my yoga mat, and I was on the floor every day trying to rehabilitate my paralyzed, my weak arm, my right arm, my right leg were very weak from hundreds. I had over 200 seizures in the first 48 hours in the EMU, the Epilepsy Monitoring Unit. I think I broke a bit of a record. So I was really working hard using yoga, meditation. I think we have to be creative and look beyond core therapies at times. I know music was one of the key things, one of the key modalities as part of this week that you were talking about. I have lots of thoughts about noise and music and sound and light, looking at light. And when I was working with people with a disorder of consciousness, we talk a lot about sensory stimulation and sensory regulation. And I now really understand the value of sensory regulation. So music and noise overall can have a beneficial effect for me, but can also have a very serious negative impact for me. And I had to very gradually build up my tolerance for music and for noise. And I would really encourage prescriptive music and prescriptive exposure to noise in the early days of recovery. Because particularly if somebody is prone to having epilepsy or prone to having seizures, because it was most definitely a trigger and is still a trigger for me. So it's just a thought and it's just a recommendation that I would have.
Alison, you're a font of knowledge in terms of your experience, and flipping it both sides, it's phenomenal to listen to you. And I think particularly about the sleep thing, I picked up on that because one of our psychologists talks about a therapeutic nap, which is much more acceptable in people's lives if you're trying to rehabilitate your brain. So having a therapeutic nap is prescribed by one of our neuropsychologists to all of our clients. Alison, thank you so much. And I also want to acknowledge, which I should have at the very beginning, Aisling, who came. Your move, Aisling, is Ali's sister who come from Wexford to be with Alison today. So it's a tag team, and this certainly multiple effort on a lot of people's part to put together the panel. Okay, so I'm conscious, Alison, thanks a million. We're going to open it up to the floor. We have about 5-10 minutes. If anybody has any comments or any questions, particularly for any one member of the panel or just a general comment, we'd be delighted to have some interaction. We can't actually see you from here, but it would be lovely to have your input if you want to ask a question before we wrap up. It'd be lovely if you'd also just say your name.
Hello, my name is Autumn, like the season, and thank you so much to all of the members of the panel for your knowledge and your expertise, your time and your stories. I was just wondering if each of you could comment on what sensory retreat do you engage with? Is there any kind of space outside of nature? Are there environments such as libraries or constructed environments that you find yourselves gravitating towards as a place of rest and sort of relaxation, rejuvenation, or healing? Thanks.
Okay. Okay, Magella.
Well, I start because it's an easy answer. I'm terrible at that. Nature is the one thing. I love hiking. I love running. You know, that's my thing, that to get out and that clears my head. That's definitely for me. I'd love to be able to be a bit more like that. I want to do yoga, but I'm actually one of those people that's terrible at just sitting still, and it's something I'm really trying to roll back on. But yeah, no, unfortunately, well, just it is nature for me. Yeah.
Don't forget, you have your dogs.
Oh, the dogs. Yeah, sorry, Jesus, we don't mention the dog.
The dog is
yeah, love
very,
dogs.
yeah.
Yeah. So.
Yeah. Alison, you talked about dipping your toes in the old river. Is there anything else there?
So the old river, but thank you, Autumn. That's a really interesting question. When I was in Beaumont Hospital, one of the people that I always enjoyed his company, actually, when he came to see me, was the chaplain. I wouldn't say I'm a holy roly kind of person, down on my knees saying the rosary every night, but I do have faith and I do believe in the power of prayer. And it was a remarkable journey for me to make it all the way down the very long corridor when I was well enough to the chapel in Beaumont. And every 12 weeks now, when I'm in having my treatment, that's where I go when I'm waiting for my lift to arrive to collect me. It's a very special place for me, the chapel.
Lovely. Thanks. And Neve?
Yeah, when you were talking about kind of indoor spaces, I was like racking my brain while you were talking. But really, as Magella was saying, I think nature is the place where I kind of revive myself or something. Or like that sensory retreat you were talking about. Like even when I'm in work or that, even if I can't get out into nature, just opening the window and taking a few deep breaths of air, fresh air, can revive me a bit. But yeah, I do struggle with indoor spaces, to do that same thing or provide the same replenishing kind of experience as nature. So
Super. Autumn, thank you. Is there anybody else? This is a hand. So, yeah.
Hi, my name is Morag. Thank you for sharing your stories with us today. My question isn't too dissimilar from Autumn's. You've talked about work, you've talked about family and church, dogs, nature. Where do you access art, given that we're trying to bring together art and science? And if you haven't, what are the obstacles to you doing that? Either past obstacles or ones that you perceive to exist in the future?
Okay, thanks, Morag. Neve, shall we?
Yeah, for me, I guess art has been a very, and I didn't speak about it yet, so thanks for the question. it was an important part of the kind of therapeutic or rehabilitative journey all the way up. I think in the rehabilitation hospital, there's lots of artistic or kind of creative activities that you can get involved in. So there was like clay and pottery making and drawing and painting and music, which I found really helpful. And I guess it can kind of tap into unconscious a little bit as well. And also then, I suppose, even within kind of mental health services and within in the inpatient stay in the psychiatric hospital, there was a huge amount of artistic activities that I also got involved in there. So poetry, music, jewellery making, pottery, and that all of those things were so important therapeutically, I think, and really provided a different, just you're accessing a different part of the brain. And kind of as I'm saying that now, I'm thinking I'm not doing much in the way of kind of art at the moment, but I suppose I've also had a baby in the last year, so life has gotten
That's enough
very
art.
busy. Yeah.
The art of motherhood.
Yeah.
Yeah.
But yeah, really important part of the journey all the way through, I think. And yeah, good question.
Great.
Thanks.
Alison or Magella, do you want to answer in terms of the...
Well, there's always been a barrier for me, as even from a childhood, about art. I always associated with making a picture and it being perfect, and I always felt I was never good at art. So that's always been a barrier for me all throughout my lifetime. Even on Fridays in school, we would do art. On a Friday afternoon, I would always do my maths homework instead of the art. That was how extreme I was. But now I'm actually seeing the benefits of it in my work now, because I work now with patients with a mild or a moderate cognitive impairment or dementia of some type, and we do cognitive stimulation therapy groups, and in that we bring in all the different types of art, whether it be music, painting, etc., all different types, and they respond to them really, really well. So I can definitely see the benefit, and it's actually opening me up to it and a bit more confidence. But personally in life, I don't use it. Yeah, but in work I do. Yeah.
Alison, I know you already spoke about music.
Yeah,
in your life,
music.
But is there anything else?
Yeah, well, it's a lovely question, and I value art in all its forms as a therapeutic modality so much. Morag, in my professional life, I was involved in the introduction of horticultural therapy and the design of a therapy garden in the National Rehab Hospital, and also the introduction and pilot of an art therapist program, and also worked really closely with music therapy with our patients with disorders of consciousness, and I've done lots of research with our colleagues in music therapy in that group. So I am wide open to the value of music therapy, or of art in all its forms. But for myself personally, it's probably in the garden I see art. So I take a wide view of art in all its forms, and colour in nature. And just the, I suppose, what you can touch and feel and smell and see out in the garden or further afield.
Thanks, Alison. Thank you very much. Okay, I think we're almost to the wire in terms of time. Yeah. So just in terms of Ian, yeah.
Just to say how humbling it is to listen to three very courageous and smart people, and to see one of our global Atlantic fellows having put together such an extraordinary session. So thank you very much. Two things I think you exemplified. The first is courage to be able to speak, because there is this stigma associated with problems of the brain, but the other is neuroplasticity. You're all three of you are walking examples of how the brain can rewire itself and combat these injuries. So thank you very much, and thank you, Grainne.
Thanks, Ian.
Thank you very much.
Thank you. So, yeah, thank you. If it's okay, just before we finish, a heartfelt thank you. Magella had to take time off work. Alison came from Wexford. Magella came from Meath. Alison and Aisling came from Wexford. And I know we had lots of people, a whole community getting you here today from Killaloe Ballina in terms of child minding and organising lives. So a heartfelt thanks to our three panellists. And their willingness to contribute has really, I think, enriched our day, I hope. And in our organisation, we recognise that many people with brain injury struggle to have their voices heard and often live on the fringes of society. And I hope through the voices you've heard today to our panel members that it has helped to illuminate some of the challenges and the experiences and has brought your attention to what life can be really like with the brain injury. A big thank you to you, your audience, and to both the people who are in the room and online for your engagement and participation. And a huge thank you to Dominic Campbell, Professor Brian Lawler and Professor Ian Robertson for the invitation to be part of this exciting week here at Trinity. So thank you very much.